But we are not using all of the tools in the toolbox. And if you look at the evaluation studies that have taken place, where our initiatives to improve health have not had as much of an impact as we would have wished them to, the evaluation tends to show the following things. We haven't used the full range of policy tools that are available to our policy makers. Even when we have a comprehensive program, quite often we don't have the necessary skills to deliver these programs on the ground, except quite often in pilot programs and demonstration projects. And even if you have the right skills, do we have those skills in the right numbers deployed in the right ways? And so much of the evaluation that is now coming through, where we're looking at whether or not an initiative actually succeeded in improving health. In the past, we've tended to just measure the outcomes and to say, well, no, this particular methodological approach didn't produce the outcomes that we were looking for. And the conclusion was, well, it was the wrong approach. Interestingly now, we're beginning to understand that in many of these instances, it was the right way forward. We just never invested enough in the capacity, the skills, and the infrastructure to actually deliver the outcomes that were anticipated. So the other two issues, having these long-term goals without the short-term measures of success, and, of course, the problem of constant organisational change. And I probably don't have to tell most of the people in this room. I guess many of you will have lived through as many organisational changes in the NHS as I did. It's one of the reasons I don't work in the NHS anymore, and it's highly disruptive. But don't just take the word of those people working in the evaluation areas of public health. If you go to the management literature and you look at the conclusions that they have drawn there about why initiatives work or don't work, they come to exactly the same conclusions. And this is looking at manufacturing output, service delivery in the commercial arena. It's not specific to health. Why didn't we achieve the outcomes quite often that we were looking for? Because we had an inappropriate standard, something in a sense I think Hamish was alluding to, a low level of resources, inadequately trained personnel. There were organisational constraints that prevented people from actually delivering the activities that were expected of them, or the objectives were unclear, or there was poor communication across the system, or indeed we just had the wrong mechanism for actually measuring what we thought we were measuring. I mentioned a few moments ago all of the organisational changes, and I don't know if any of you have seen this. This is from somebody outside of the healthcare system. And he said, we trained very hard, but it seemed every time we were beginning to form teams, we would be reorganised. And I was later to learn that we tend to meet any new situation by reorganising. And a wonderful method it can be for creating the illusion of progress while producing confusion, inefficiency, and demoralisation. Now, I'm sure that will actually resonate with many of the people here. The worrying thing is that this was actually said by a Roman general in AD 66. So, the evidence suggests to us that we need to use the full range of policy instruments that are available to our policymakers, and we need to have the necessary capacity, the capability and the infrastructure to ensure delivery. It's no good having a wonderful idea, an evidence-based methodology, if you don't actually build up the system to the necessary extent to actually deliver the outcomes you're looking for.